Injury to Wellness Centers. We're a chiropractic clinic, and we take care of patients mostly that have been involved in a car accident or some other type of injury. And the purpose of our practice and our mission is actually to take those injured patients and not only get them well, but then to lead them on to a healthier lifestyle in general, because so many people can really use that type of health support, especially right now with everything going on. So been in practice 19 years. I started in 2002 in Decatur, and the main reason why I became a chiropractor and was interested in having this type of practice was I just grew up like everybody else, relying on medicine, probably a little bit too much, um, and not focusing on natural health and my own body's ability to take care of itself. So in college, I worked for a brief time in a hospital, thinking that I would go to be a medical doctor, and then decided that I really didn't like that environment and I wanted to change my course, and I became a chiropractor instead. Chiropractic, of course, is natural, a natural type of healing, and we do not prescribe medicine. Although we work really well with our medical doctors and what have you when we have to take care of our patients, but in terms of maintaining your health, you can't rely on medicine to maintain your health. You really need that when you're sick. So I focus on this healthcare more so now, and that's what's exciting about chiropractic. I like to say, just like anybody who goes to the dentist, you have to go to the dentist because you have teeth, right? If you have a spine, right, then you have to go to the chiropractor. So really anybody, but the most common would be, like I mentioned earlier, anyone who is involved in a car accident really should be seen by a chiropractor within the first couple days of actually having that accident. So we usually tell our patients, if you have an accident, come and see us as soon as possible so we can evaluate your spine and see if there is any misalignments, or maybe you're dealing with pain, and we can actually treat that in a way to help lower the pain and make you uh, uh, more comfortable, and more sooner you come in, the better. Uh, Also, anybody who has any long-standing pain in their body, really, if you're someone who has lived with headaches for many years, or you just have back pain, maybe your type of work that you do. So pain is a symptom that we see a lot in our chiropractic clinic, and we definitely try to get to the cause of that pain that you're having. And so pretty much anybody who has a pain should be evaluated by a chiropractor as well.
Okay.
Well, our greatest impact for COVID-19 is really just trying to keep that wellness focus. It's really hard to do when you have almost a tidal wave of of information, and people's fears are on a higher level, and so everyone's more nervous and they're afraid to um, interact with each other. Of course, we're being advised to social distance and mask and remain, can't even hug family members and what have you. So it's very hard to maintain the focus and the core philosophy that we are healing organisms. We do have an immune system, and the immune system is something that is designed to fight off disease, viruses, and such. And that, included in that, is COVID-19. I know that we've lost a lot of lives to COVID-19, but there's a lot of lives that have not been lost. And in a good part, those people that have recovered from infection have expressed their own body's immune system function, and that's what's killed the COVID-19. And it wasn't a medicine that did it; it was their body. So we have to have some reassurance that our bodies, when it getting an infection, do have the ability to fight it off naturally and to maintain, our own sense of strength, and not all of a sudden just think like, oh goodness, if we get it, it's going to take us. Oh, that's not always the case. And we see that to be true in just, you know, the recovery rate, the survival rate of COVID-19 is very high as well. So we can focus on that as well. In our practice, we have several precautionary steps. We screen patients on the phone before they come in for their appointments. Upon entry to our clinics, we take their temperature. We also make sure that everyone is wearing a mask. And then we encourage hand washing upon entry. So the minute somebody walks in, we ask them to please wash their hands. We don't rely on hand sanitizer alone. We know that that's not as effective as good hand washing. But then we also have hand sanitizer throughout the office that will allow uh, people to use hand sanitizer. And so those are some of the steps that we do. We also do our touch points and our cleaning, our cleanliness standards. We've always been a clean office. Our clinics are very clean, but just step that up as well. And we do sanitization. We have all the PPE that we need and all the cleaning supplies, and we've been able to maintain that throughout the whole pandemic. And our clinics are open 6 days a week. So you can imagine that's a lot of Lysol spray. It's a whole lot, but we've been keeping it clean, and patients have noticed that. It's reflected in our Google reviews. A lot of our Google reviews do mention the fact that we're a clean chiropractor. So. Well, right now, probably just trying to get back to focusing on some of the health and wellness that I like to promote in the community. It's very hard to do that if you can't do a health fair, for example. And we used to do maybe 10 or 12 health fairs throughout the year in various communities. So now we have to focus internally until we are able to do that. And so every patient that comes in, we have our orientation class and we teach them about health. But as soon as we can get back to getting out in the community and doing health fairs, we're going to welcome those opportunities. And I'm sure there's people that will probably watch this video recording, and in the future they may have health fair opportunities that we can join in with. We're used to partnering with our local as far as the city of Jonesboro, for example, the city of Clarkston. They had special events. We would participate in those. So we'd like to do those things again. As soon as they're out there, we're going to get back to it. Our biggest focus right now is actually internally um, with each patient, uh, kind of, I want to say, promoting health and wellness directly to them, because there are going to be our close link communication to their friends and their families. So we're having a monthly rotation of various topics. And next month, for example, we're going to be explaining subluxation. Subluxation is the condition where the body is blocked, and this happens in the spine. This can cause you to have less health in your body. So we're going to focus on that, and each month we're going to have a different topic. One of the mistakes that I made early on was I did not have a mentor or someone really to bounce ideas off of. I try to do everything myself. And in doing that, I was trying to recreate the wheel, so to speak. Um, so now, even 19 years in practice, I provide mentorship to younger doctors and chiropractors or business people. I mean, even some of my employees who are former employees have decided to start their own business. I would give them some mentorship on how to do that, you know. Um, but even 19 years in practice, I have to have my mentors, and I do have them, of course. And I often call them up and I have to ask them, what do you think about this? And what do you think about that? And does it sound like I'm going in the right direction? So sometimes reaching out to our colleagues is one of the things that we have to get used to doing, because it's going to help push you further and not to shy away from that. You don't have to be by yourself. So That's what I would say would be my early mistake that I made. Yeah. Our website is a great website. It's www.injury2wellness.com, and that's the number two. And our phone number is 404-288-8433. We do have 3 locations right now. Our fourth location is going to be opening in April, and that is going to be in Lithia Springs, Douglas County. So I'm going to be expanding out to the other side of town um, very soon. So all that contact information is fine to post and share. And hopefully, if anybody's in the area of Lithia Springs, stop by. Whenever you want to check out a chiropractic clinic, you're more than welcome to stop by any of my clinics and you'll get a tour just by asking. We like to show off our facility, and we like to, we would do it in a COVID safe way, of course, but we're happy to welcome people who are just interested to see what we have to offer. And, and, people should do that when they're deciding where to get their treatment. So, go get a tour, meet the doctor, meet the assistant, and we'll take you over to health. Would probably be just how everyone's kept it together as much as they could. I do see a lot of inspiration around when I look at everybody's individual situations and how they've been able to mitigate those circumstances. Every business that has stayed open long enough and hasn't gone completely belly up had to be very creative in how they adapted to the situation. And so that's really inspiring to me that you can have as much success around even after an entire year pandemic. So I just think that that shows a resilience in our community and in our people, and that's very inspiring to me.